Hi, I'm Dr. Anthony Cave, and I have felt pain when I've trusted somebody and I've been betrayed. That betrayal doesn't hurt when it comes from any rando. It comes when you trust someone and they don't reciprocate back that level of care that you deserve based on the trust that you're giving them. And society places a lot of trust in doctors. Yet so many of us are hurt when we feel that our doctors have blown us off. Not because doctors are unwilling to help. That sometimes happens with arrogant or narcissistic doctors, but it's far less common than in cases when doctors are simply unable, because of constraints from an insurance system, for example, to be able to give patients the care that they deserve. I don't have any delusions of being able to fix the broken healthcare system, and nor should you. That's why I want to share 3 tips with you so that you can make the most of your limited time with your trusted doctor to leave feeling empowered as an advocate for yourself instead of a victim to an unsatisfactory healthcare system. And number 1 comes from a story that I just saw recently for a patient about to have spine surgery. They're the last patient of the day. They've been delayed. They're very scared. They told me the night before that they couldn't wait for the day after surgery because they were so anxious. There are risks with spine surgery that are very legitimate. You might wake up paralyzed. You might wake up with more pain than you had before. So when I was watching from the back, the patient speaking with the surgeon and the patient being honest about, "Doc, I'm really anxious and I just can't wait for this to be over," I waited for the doctor's response. And the surgeon completely blew them off and said, "Well, this is what you're going to expect when you wake up from surgery and blah, blah, blah." And I gotta say, this broke my heart. I certainly tried to do my best to help alleviate their concerns, but what they could have done in that case, right before surgery, in a position of vulnerability, they're in a hospital gown, almost naked, looking up to a surgeon. All they would have had to say, as the surgeon turned around to walk away, without acknowledging any of their concerns before surgery, was, "Wait, doctor, I'm a little unclear about the plan, and I'm actually really anxious because my last surgery didn't go so well. I couldn't sleep last night because of my anxiety over the plan. It's unclear to me. Can you please tell me what I should expect today and for the next week as I'm recovering?" It might seem obvious to you and me to call out a doctor respectfully who is blowing you off before surgery. But when you have all of the adrenaline kicking in, whether for a doctor's appointment for yourself, for a child, before surgery, maybe you're a woman. This happens so commonly, unfortunately. That whole culture of viewing gynecologic problems as related to hysteria can absolutely torpedo relationships, just like this patient before surgery. And all it takes is honestly calling out a doctor respectfully and saying, "I am unclear about the plan." Any doctor trained in an allopathic or osteopathic Western medical system knows that the plan is where the money is. We doctors get paid for assessments of patients and plans for their care. As a patient, you need to feel comfortable and empowered to ask your doctor what their plan is for you. And if you have any ambiguity, you need to be confident in your ability to ask for what the plan is, whether it's a surgery plan, whether it's abdominal pain, a chronic cough, acid reflux, it doesn't matter. "Doctor, I am unclear about the plan. It's making me anxious, and I actually couldn't sleep well the night before because I didn't know what to expect. Can you please clarify that better for myself?" Or if you've brought someone else with you, "Can you please clarify it for my wife, my husband, my father, mother, whatever?" By the way, if you appreciate these concrete tips or have other suggestions for what you'd like to hear about, please let me know below in the comments. And if you could hit that like button, you can support me doing this for you more often. Let's move on to number 2. Number 2 is to bring a pen and paper so that you can actually write down what the patient is saying. Because I'll guarantee you, it's harder to blow off a patient who's taking notes diligently on what you're saying. Sometimes patients bring their phones with them, and you can do that, but you need to be very clear that you're not texting someone on your phone, because that happens a lot across all patients, but more commonly amongst the younger patients. They whip out their phones, and I can't help but feel that there might be a little bit of disrespect or distraction from that phone. So I always recommend a pen and paper, or at the very least, you can tell your doctor that you're jotting notes on your phone and not texting someone or watching a video or something. All you need to say is, Doctor, I want to make sure I understood you correctly. And then what follows is specific to your plan. You think my pain is because XYZ. You want me to do XYZ. You think what I'm feeling might be a result of XYZ. So for example, doctor, I want to make sure I understood you correctly, as you're writing notes. You think my abdominal pain is from a gastric ulcer, and that's why there might be some blood in my stool? This is very closely linked to bringing in a diary in that notebook as well, because when you bring objective evidence or objective data for the doctor, it shows that you know what's going on in your body. If you show in your notepad that, yeah, my abdominal pain, for example, has gotten worse over the last 3 weeks, I know my body. I know this isn't normal. I don't know what it is, doctor, but I know this is not me. And my symptoms of pain, or bleeding, or depression, or anxiety, mood, hunger, etc. are not normal for me. But to do all of this, you need to be prepared. And half of this preparation is bringing your notebook with you and your diary with you. The other half is mentally being prepared. And I cannot emphasize this enough. When patients come to the doctor's office with me, some of them have been wronged by doctors in the past or by the healthcare system in the past. And they bring a tremendous amount of resentment and anger and frustration with them. They're like a train going on the tracks at 60 miles an hour, hell-bent on their anger and frustration. It might be valid, but it's not valuable to come into the doctor's office angry at something from the past. And it's hard to go from 60 miles per hour down to 0 miles per hour so that your mind can be present and you can ask the right questions, and yet you can remember the right questions in case you feel blown off by your doctor. You need to be quick to respond, to advocate for yourself. When you have the inertia of that bullet train, you can't stop it in a doctor's office, especially if you're already anxious, if you're already in pain, if you're hungry, etc. If you can slow your train down to 30 miles per hour from 60 miles per hour, you have to recognize that it is so much easier to bring yourself to 0 miles per hour. The difference from 60 to 0 and 30 to 0 is 4 times the energy. That's from physics class in high school, 1/2 mv squared. Going from 30 to 0 versus 15 to 0, it's 4 times easier when you're only going 15 miles per hour. That way you can collect your thoughts and have a more meaningful interaction in that limited time with your doctor. It's not easy to do this, and that's why it has to be done before you come into the doctor's office, because no amount of Valsalva breathing or meditation, etc., is going to take a bullet train down to 0 miles per hour to effectively communicate and advocate for yourself with the doctor or the nurse practitioner or the physician's assistant or whoever might be in the office with you. When you can slow your train down, the more effective that mindset will be. And number 3 is to recognize anxiety and frustration in yourself and in your healthcare provider and be comfortable calling it out. Remember that frustration is often anxiety on overdrive, meaning that if you're very anxious, you're likely to become frustrated at the situation. The more frustrated you are at the situation that has not changed, that can lead to anger, all stemming from anxiety in the first place. If you find your doctor frustrated at any point, you need to feel comfortable saying, "Doctor, I feel like you're frustrated. Is there something that you're anxious about? Maybe it's the time of our appointment and we're running out of time. Maybe what I explained to you wasn't clear and you're confused about my story." Whatever it may be, if you call your doctor out respectfully, you will allow for a more trusting relationship. In many, maybe not all doctors, but you won't wrong anyone by simply observing and empathetically reaching out. This is not blaming them or attributing fault, but simply inquiring out of a place of curiosity. The same goes for yourself as the patient. If you begin to feel frustrated, you need to feel comfortable explaining to your doctor, "Doctor, I'm feeling anxious about your explanation and the plan, and I'm beginning to feel frustrated. I don't want to feel this way because I know you are trying to help me. I need a better explanation, please." You are not attacking or threatening the doctor. You're simply recognizing your emotional state expressing that respectfully to the doctor and telling them that you need a better explanation. It is so much harder to blow off someone who communicates with you that way when you're in the doctor's position. I've seen this happen so many times, and I really appreciate it when the patient feels empowered and when they feel confident. Speaking to a doctor in such a respectful and thoughtful way will catch them off guard if they're daydreaming or frustrated, or if their mind share is not present with you, the patient, in that moment. It will get their attention and help bring them back to focusing on all that matters in that room, which is you, the patient. The doctor is there for you. The doctor makes money and a living off of treating you, and you deserve the care that comes from that mind share and that presence and attention that is aimed towards you walking out feeling better and feeling healed even before the first medication goes in. Because when a doctor gives you that respect and gives you that attention, that is the first step to healing. And I can't emphasize enough that if you walk out feeling gross or feeling unheard or feeling disrespected or blown off, it's that much less likely that whatever treatment they prescribe is ultimately going to help you feel as healed as you could be, because the mind and body are so deeply connected that your mindset from a healing interaction will dictate, oftentimes, just how healing that plan will be.